Hi everyone, today I'm going to be demoing OmniCare AI. We're going to start by logging in with Google. If you don't have an account, you can create an account, or if you have an account, you can just sign in with Google. I already have an account, so I'm going to sign in with my Google account. So on the main dashboard, you'll see four main sections. The four sections are triage, inventory, vision portal, and the at-home symptom checker. We're going to start with triage. So this section shows incoming patients and sorts them by how urgent they are. Normally, a physician would enter all this information themselves, for example, patient full name, age, ESI override, which this is basically how urgent their need is. Sometimes if they click auto classify, it'll classify it or like queue it by itself and like, recognize how urgent it is. If you don't need that, here's the levels. You can just click it manually. Here are the vital signs, and this is the main complaint, basically. So what you're like going into the emergency room for. And then this is medication and resources that the patient has been on or prescribed. Since we don't have any patient data, we're going to press autofill sample data and then press queue patient entry. So here it shows us the information about them and shows them by queue. See, the ESI ones are going to be at the top, while the ESI like fives or fours or threes are going to be at the bottom, because the ESI ones are the most important. Now, just to understand this, these are the complaint, name, year, or how old they are, vitals. This is allocated medicines or what they're on. Here's the diagnosis. So basically, physicians upload their diagnosis here: physician name, care plan, formal diagnosis. But no diagnosis has been uploaded so far. So this is like the diagnosis. And then the care plan assistant is basically if you have a question and you need to ask about it, you instead of needing to like go in and ask about it or call, you can always ask the care plan assistant. Next, for view prognosis, you see how long the recovery is going to be. It's estimated, it's not exact, but here's the like expected timeline, long-term progression expectations, and treatment and rehabilitation plans, and recommended medications, of course. Next, we're going to move on to the bioresource inventory. This basically just shows supply sliders, and it identifies when one slider is really low and when the hospital needs to re-gear or resupply on them. Here's the vision portal. So let's say I have an image of a burn. Here, let's search that up. Burn image here. Here's an image of a burn. Let's say I upload one from my drive. Here it downloads. And let's say I download this and put it in. So it'll basically analyze it and it'll identify what type of it'll analyze the image. So this image depicts a wound bed exhibiting signs of inflammatory and proliferative phases of healing. The red moist areas suggest granulation tissue, which indicates new blood vessel formation and tissue repair. However, the presence of yellowish stringy material and darker crusted areas, blah blah blah. We know. This is basically progression tracking, how like the progression through week and week. And finally, the at-home symptom checker is where you're going to describe what you're experiencing. So this is for at-home use. Basically, if you don't know if you should go into a hospital, if it's a medical emergency, we have this banner above just to make sure that if it's an emergency, they should automatically go in. But describe what your experience is. So we have symptoms and situation, and then age, and then other contexts. So let's say we have a kid, teenager with asthma, and basically they're coughing up mucus, and their lungs are inflamed. Their age 14, and then analyze my symptoms. So basically, this AI will analyze it, and it will tell you when to see the doctor. So in 1 to 2 days, and possible explanations. In addition, it'll recommend your next action. And then also, if you have follow-up questions, you can also ask here. So if you have any questions about it, you can ask the AI. For example, like, oh, what should I do like after I see the doctor or something? So yeah, that's pretty much OmniCare AI. Thank you for watching.